Osteoarthritis isn't just about joint pain. It's about learning to move again, to manage inflammation, and to protect your independence. Many people think that there's nothing that can actually be done once the cartilage wears down. But there's a lot that can be done to manage osteoarthritis and live an active and fulfilling life. Let's break it down, what actually works step by step so that you can learn how to start even today. Number one, movement is medicine. Now, resting too much after pain sets in feels more natural, but it is one of the biggest mistakes. When your joint stays still, the cartilage gets less nourishment, your muscles weakness and the stiffness worsens. It becomes a painful circle. Pain causes rest, and rest causes more pain. The best remedy is gentle and consistent movement. Low impact activities like walking, swimming, cycling, or simple stretches keep your joints lubricated and your muscles strong. Even 10 to 15 minutes a day can reduce pain and improve mobility. Remember, motion protects while immobility destroys. Number two, manage weight and inflammation. Every extra kilo of your body weight puts more pressure on your knees. That's why weight gain and chronic inflammation speeds up joint damage. But crash diets or starvation don't help. They actually make your muscles lose worse. Focus instead on small, consistent changes. Eat whole foods like fruits, vegetables, fish, and olive oil. Limit processed sugar and red meat. Drink plenty of water. This isn't just about weight, it's about calming inflammation inside your body. Your diet can either feed the fire or fight it. Number three, strengthen your muscles around the joint. Strong muscles are the best joint protectors. They act as shock absorbers. But many people avoid exercise out of fear of pain. And that's when the muscle weaken further and put more strain on the joint. You should start small. Focus on quadriceps and hip muscles for knee arthritis, the core and back muscles for your spine issues. Use resistance bands, light weights, and even body weight. The goal here is not to train like an athlete, but it is to build stability, balance, and confidence. Remember, it is not pain-free movement that we are after. It is safe and steady movements. Number four, pain management and self-care. Let's talk about pain because ignoring it doesn't help, and over-medicating can cause harm. Osteoarthritis pain can flare up unpredictably, making people reach out for quick fixes. But pain is your body's signal, not your enemy. The most effective approaches combines heat therapy for stiffness, cold packs for inflammation, topical gels, and prescribed pain relievers. For chronic pain, physical therapy, gentle massage, and mindfulness can also help reduce tension. Number five, work with your healthcare team. Osteoarthritis management isn't a solo journey, it is a team effort. Many people wait until pain is unbearable before seeking help, missing the window for early management. Regular check-ins with your doctors, physical therapists, occupational therapists help adjust your treatment, monitor the progress, and keep your motivation high. And in severe cases, joint injections or surgery can bring major relief, but they are not the first step. The goal is to stay active, informed, and ahead of the disease. So, to manage osteoarthritis, remember these 5 essentials. Number 1, move daily. Number 2, maintain a healthy weight. Number 3, strengthen your muscles. Number 4, manage pain wisely, and number 5, partner with your healthcare. Osteoarthritis doesn't have to define your life. It is a condition that you can control through knowledge, consistency, and self-care. Remember, your joints can age, but your movement can stay young.